Hello everyone. Today, let's talk about a very practical and concerning topic: how to build muscle after the age of 60. It sounds a bit exaggerated, but I want to explain it in a more helpful way for you. Not simply comparing the protein content in grams, but looking at which food can better cooperate with muscle synthesis in the physical condition of the elderly, helping you turn your diet into a truly usable force. For a long time, research has found that increasing the daily protein intake of the elderly, improving blood supply to muscles, and restoring the environment is actually more crucial than simply pursuing the protein content of a certain food. Remember to subscribe so you won't miss a very useful channel. We'll delve into more daily foods and drinks that can quietly improve your health from the inside out. If I have to name this kind of fruit, I would recommend pomegranate. Pomegranates are rich in polyphenol and components that can promote vascular function. Experiments have proved that short-term intake of pomegranate extract or pomegranate juice before exercise can expand the diameter of blood vessels, improve local blood flow, thereby delaying fatigue and enhancing endurance or oxygen supply efficiency during exercise. For muscle synthesis, good blood flow helps deliver amino acids and oxygen to muscle cells more quickly and fully. Especially for the elderly, due to the decline in vascular function, the benefits brought by improving microcirculation are often more obvious than relying solely on eating more eggs. Let's talk about one more mechanism. As people age, their muscles become less sensitive to nutritional stimulation, and relying solely on a regular dose of protein may not fully activate the synthetic pathway. Therefore, in addition to increasing the total amount of protein, it is recommended that the target for the elderly be about 1.0 to 1.2 grams per kilogram of body weight, depending on their health condition. It is also necessary to improve the recovery environment, reduce inflammation, increase blood flow and oxygen supply, so that every mouthful of protein can be more effectively utilized by the muscles. In other words, treating pomegranates as an assist rather than a substitute can enable the same protein to exert a higher effect. Apart from pomegranates, beetroots, though strictly speaking, they are roots rather than fruits, contain a large amount of dietary nitrates, which can be converted into nitric oxide in the body, dilating blood vessels, improving muscle function and endurance. Studies on the elderly have also shown that short-term nitrate supplementation, such as beet juice, can lead to improvements in muscle function. However, there are significant differences among different groups of people, and those with blood pressure medication or impaired kidney function should use it with caution or consult a doctor. Taking beets or green leafy vegetables containing nitrates as alternative options is also a feasible approach. Returning to the claim that pomegranates are more effective than eggs, eggs are undoubtedly an excellent source of high-quality protein and essential amino acids, including leucine, and are the stars on the plates of the elderly. However, if you usually have poor digestion and absorption, poor blood flow, or slow recovery, then the muscle-building effect of eating eggs alone will be limited. Consuming pomegranate juice or pomegranate concentrate with protein before training or meals may enhance the response of muscle synthesis by improving blood flow and inhibiting excessive oxidative stress, thus being more helpful in practical effects than just eating eggs. Here are a few practical suggestions for you. First, ensure the total daily protein intake. It is recommended to discuss with a nutritionist or attending physician to determine the target value that suits you and evenly distribute it among your 3 meals and snacks every day. On strength training days, it is especially important to allocate some high-quality protein within 1 hour after the training. Second, equal emphasis should be placed on training and nutrition. Strength training, resistance training, is the main signal to stimulate muscle synthesis. When combined with appropriate protein intake and foods that improve blood flow, the effect is cumulative. Thirdly, you can try the combination of pomegranate plus protein. 1 cup of about 150 milliliters of pomegranate juice, or half of fresh pomegranate with 20 to 30 grams of high-quality protein, such as yogurt, whey protein, or soy products, once before and once after training. There is no need to drink a large amount for a long time. Observe your tolerance. Fourth, pay attention to individualization and safety. Pomegranates are good for health, but there's a possibility of drug interactions, especially when taking certain cardiovascular drugs or anticoagulants. Beets or high-nitrate beverages may affect blood pressure, or people with a risk of kidney stones should not consume them frequently and in large quantities. Therefore, before starting any new supplementation, it is advisable to communicate with your attending doctor first, especially for friends with chronic kidney disease, severe cardiovascular and cerebrovascular diseases, or those who are currently taking medication. Caution is the best, and safety comes first. Fifth, do not overlook the role of anti-inflammatory and antioxidant nutrients. Research suggests that antioxidant substances can help reduce oxidative stress in muscles, improve the synthetic environment, and thereby indirectly support muscle maintenance and recovery. Here are 2 simple combinations that you can try right away for practical dietary examples. 1. Breakfast set. 2 boiled eggs, or 1 serving of soy milk, plus 1 serving of low-fat dairy products, plus a small bowl of fresh pomegranate seeds, or half a cup of pomegranate juice. If the taste is too sour, you can add a small amount of honey or pair it with oats. Second, post-training supplementation. Mix a cup of low-sugar yogurt with a small amount of pomegranate juice and a spoonful of whey protein. Add some nuts or a small amount of dried fruits to increase calories and essential fatty acids. This combination contains both fast-absorbing amino acids and polyphenol that help with recovery. Remember that both the portion and the total amount should be adjusted according to your weight and medical history. Also, some friends may ask, which fruit can directly replace meat or eggs? The answer is usually no. However, some dried fruits or sun-dried berries, such as sun-dried white mulberries, have a significantly increased protein ratio based on their dry weight and can be used as snacks or as a supplement to yogurt. But they should still be regarded as supplements rather than the main source of protein. Dried fruits have a high calorie density, so attention should be paid to their sugar content and calorie intake. Here are some simple suggestions for training. For beginners over 60 years old, doing resistance training 2 to 3 times a week is sufficient to bring about significant improvement. Each time, select 5 to 8 major muscle group exercises, such as seated press, seated row, leg raises or half squats, hip bridge. Perform 1 to 3 sets for each exercise, with 8 to 12 repetitions in each set. Maintain a good posture and breathing, and rest for 60 to 90 seconds between sets. If you have bone, joint, or cardiovascular problems, the intensity of your training and the choice of movements must be adjusted under the guidance of a rehabilitation therapist or coach. The dual combination of training and nutrition is the key to increasing muscle strength and improving functionality in the long term. Let's talk about a few details that are often overlooked. First, chewing and digestive functions can affect protein absorption. People over 65 often have dental or swallowing problems. It is advisable to prioritize easily digestible protein sources, such as soft tofu, yogurt, ground eggs, and egg white powder. Second, relying solely on the star food on a single day is of no use. Long-term dietary habits and training plans are the fundamental. Consider foods rich in polyphenol, such as pomegranates, as part of your long-term diet, rather than the short-term shock. Thirdly, the intake of salt and water should be balanced. During training, pay attention to the supply of calories and electrolytes to avoid a decrease in training efficiency caused by dehydration or hypoglycemia. Here's a concluding piece of advice for everyone. If you want to effectively build muscle after the age of 60, shift your focus from which single food contains the most protein to how to make the most of every bite of protein. Using fruits like pomegranates or their juices, combined with reasonable protein intake and systematic resistance training, as well as chronic disease medications and kidney function tests, can make muscle-building plans more efficient and safer. Any nutrition and training program is recommended to be discussed with a doctor or a nutritionist first, with individualized adjustments made step by step. Only in this way can muscle building be sustainable and reliable. That's all for today's sharing. Don't forget to subscribe and like it, so you won't miss the next video. We'll delve into more daily foods and drinks that can quietly improve your health from the inside out.